So at MSK, we are currently offering very low dose radiation for indolent non-Hodgkin lymphomas because these lymphomas are very sensitive to radiation therapy. The standard treatment dose is 24 gray, but 4 gray has shown in randomized data to have excellent local control of 70%. We wanted to evaluate our experience retrospectively, and we updated our prior publication looking at 1,025 lesions treated with very low dose radiation therapy. We offer this therapy in a response-adapted approach where patients get the 4 gray and then get a scan 8 to 12 weeks later, and based off that response, additional radiation is recommended or just further observation. In these 1,025 lesions, we found that at 2 years, the incidence of local progression was only 16%, and then at 5 years, only 26%. When comparing what factors might correlate with increased local progression, we found that patients that were treated with curable intent had improved local progression at just 15% at 5 years. We also found that patients that had larger tumors of greater than 6 centimeters, stage 3 disease, or had prior exposure to systemic therapy, that they would also have an increased local progression rate. Finally, we found that the response rate was 91% in the entire cohort, and given that this treatment is very easy for patients of just 2 fractions with still excellent local control, that we think this is a versatile treatment that can be offered for patients and benefit their disease control, but also palliation of symptoms as well. So this approach seems appropriate for patients that have need for palliation and advanced stage disease, but the challenge remains, is this lower dose of radiation appropriate for patients that are treated with curable intent? The current standard of care treatment for indolent non-Hodgkin lymphoma when it's localized is 24 gray of radiation. We discussed this in another presentation at this meeting and showed that the freedom from progression at 5 years of doing this approach in patients for potential cure is 64%. And as we mentioned, the local control is better in these patients. So the next step to make this go out into the community and change the standard of care is a prospective trial. My mentors at MSK Radiation Oncology have designed and now recently opened a trial called Fortress, which will be randomizing patients that have indolent non-Hodgkin lymphoma treated with curative intent to being treated with 4 gray with our response-adapted approach to 24 gray with the primary endpoint of progression-free survival. We hope this way we can evaluate this approach in a rigorous manner and ultimately influence standard of care.